So my name is Dr. Deirdre Harrington and I'm a lecturer at the Diabetes Research Centre.
Hi, I'm Dr. Michelle O'Reilly and I'm a senior lecturer at the University of Leicester working at the Greenwood Institute of Child Health, and I also work for the Leicestershire Partnership NHS Trust.
So over the last 3 years, myself and my colleagues at the Diabetes Research Centre have developed, piloted and delivered a family-based programme for the prevention of type 2 diabetes in adolescents and their parents. Overall, 27 families have been recruited and have attended the programme. We've now come to the point where we would really like to invite these families back one more time and just ask them some questions. We really want to understand what has worked and what hasn't worked for them now that they've finished the programme and they've gone back into their normal daily lives. What have been the barriers and facilitators for them making lifestyle changes?
And we feel that lifestyle and social dimension to this project is what makes it so original and important, that we need to move beyond individual factors and start looking at a more systemic approach to this issue. And bringing in sociological theory as well as social psychological theory will help us and enable us to look at the way in which there is a broader dimension around the child and the family, as well as the influence that the family themselves have on this issue. And that's partly why we feel that a qualitative approach is so important for this project, because it allows it to be a participant-driven approach which brings things from the perspectives of the participants themselves, from the families themselves. Of course, because this is a health-related project with a social dimension, it will require NHS ethics, and NHS ethics is something that I do have experience and expertise in doing. I can also bring to this project quite a lot of qualitative expertise as well as working with children and doing research with children, and I hope to support the diabetes unit in being able to have a kind of holistic approach to this project.
So this is a really good discipline bridge between the disciplines of preventive medicine and sociology. So we'll be able to look at the outcomes of our gold standard randomised controlled trial through the perspective or through the lens of social theory. And this is something that has been largely missing from this type of research.
I think it's really important that Deirdre and her team and myself work together so that we can have this multidisciplinary focus to doing research with young people and their families, bringing in a whole range of different areas, including medicine and social science.
So the outcomes of this and the long-term impact are quite important to both of us and our team. The short-term outcomes will mean we've got data for future collaborative grant applications, and also the long-term impact means that we can tailor our prevention programmes to the needs of the UK population in the 21st century, meaning better health and wellbeing outcomes for young people and their families long-term.